Hello everyone, welcome to April's edition of Ask the Derm. And for those of you who are not familiar with this, this is a platform we came out with earlier this year to allow a lot of our followers, whether they be patients or patients who haven't quite come to see us yet, to be able to have an avenue to ask us some questions that they'd really like addressed by a dermatologist. So our first one that we have today is, can you use any retinol products if you have super sensitive skin, or rosacea is what they wrote. So the question is maybe on those. So, retinol products, we always describe that retinols are kind of a love-hate relationship. We love them. I've used one for like 20-30 years. They're a great product. They could be used anywhere from acne, for just cellular turnover, rejuvenation, anti-aging, fine lines, wrinkles, evening out skin tone. So there's so many great reasons to use those. So we encourage them in most of our patients. The issue is most of our rosacea patients, we always say you kind of have that super sensitive skin like this patient is describing. So the question is, most of our patients we can still get you on a retinol. It's just a matter of finding the right one. And there is over 100 different type of products, that have those retinol ingredients. So you typically want to find like more of a cream based or like a low potency, based one. Maybe one that has other ingredients in it that can counteract some of the side effects that are associated with retinols. And then also you can oftentimes combat it with other emollients or moisturizers, and just upping your regimen, decreasing maybe your exfoliants, your alpha or beta hydroxy acids, the intensity of your cleansing regimen. You can typically kind of get around it. Oh, I would say don't lose hope, okay? We'll typically be able to get you, be able to get your skin used to one if we find the right one. And then definitely you can plan that we'll graduate you, possibly to a stronger product as your skin tolerates. All right, we've got our next question. It's a really good one. And it says, why can't I put sunscreen on my newborn baby? And this is a really good question, and I'm really glad that someone asked this question, because I've got 3 little kids who are no longer newborn babies, but they did have that newborn baby skin at one time. So what happens is, the reasons why we don't recommend putting sunscreen until at least 6 months of an age is the skin of a baby is so thin that it actually absorbs anything that you put on it. In fact, when a baby is newborn, or they're actually like a preterm baby or a preemie, the skin is so thin you can actually deliver medications through their skin, so they don't have to inject it or swallow it. It's basically called a transdermal delivery of medication. So that's one of the times we take advantage of how thin their skin is. You literally can see through it when they're a preemie or born before their due date. What happens is, if the baby is young, less than 6 months, that barrier and that defense hasn't quite been given enough time, okay, to defend itself from all the things out there. So we don't want to be slathering your baby with things, a lot of ingredients, and have them absorb. So I think the biggest thing is, what we talk about is, that doesn't mean that you do what they did in the old days and set your baby out in the sun, okay? We still have to do really good sun protection with him up to 6 months of age, but we typically seek out other sun protection options other than sunscreen. So putting them in a bassinet, having little drapes, umbrellas, other canopies, putting them in a shade in the stroller, or in a blanket under a tree if you're outside. If you absolutely are in some sort of situation and your baby is less than 6 months, you can use a small amount of sunscreen. So I'll say there's always a little gray area in there. I'll say, but if you do a sunscreen if they're less than 6 months of age, I definitely say picking one with a physical or non-chemical type of sunscreen. So that would be zinc oxide or titanium dioxide is what you're looking for in those two. And again, you mostly want to be covering that baby with, a hat and some protective clothing. There's going to be little areas on that baby that might be exposed. Maybe their shins, the backs of their hands, maybe the apples of their cheek, So put a little bit of sunscreen on those areas. But for the most part, I didn't put any sunscreen on my kids till they were about 6 months of age. I was pretty much able to cover them with a lot of sun protective clothing. And there are so many fun sun protective clothing options out there. Every year it's exploded. Again, my kids are 11, 13, and so the options even from now until then are just they have just exploded. So take advantage of all those fun clothing options that are out there. All right, we've got another good question. So this is a really good question and timely as we head into kind of that spring and summer season. This person wrote, what products or treatments do you recommend for mustache melasma? And for those of you who fortunately don't know what that is, mustache melasma is that little kind of brown hyperpigmentation that you get kind of on that upper lip that typically you don't want. This is usually probably a question, I'm guessing, from a woman who put this in here. You typically will see it, it does pretty good in the winter months, and then boom, right in the summer, or maybe someone goes on a sunny vacation, and it literally, that sun acts as a fertilizer, and it just boom, all of a sudden you wake up and you literally didn't have it yesterday and you have it the next day. Melasma is a hyperpigmentation of the skin, typically from a couple different things. Number one is sun. It can also be from heat exposure. Genetics is a huge thing, or hormones. So hormones that come in, we see it a lot with pregnant women or women who might be on oral contraceptive pills. And so those are reasons why it can be worsened. So my first question would be to this person is, when they say what products or treatments do you recommend for treating this mustache melasma, the first thing I say is let's take away those things that are probably making it worse, okay? So consider if you need to look at another option other than oral contraceptive pills. Let's look at your sun protection. Is there certain things that we can improve on? Hats, sun protective clothing, and then picking the right sunscreen. So important. So I want you to look for a sunscreen that has zinc oxide in it, but it also has a little bit of iron oxides in it. So it's going to be a tinted sunscreen to use in that area. And I want at least a 30, preferably a 40 to 50 SPF if we're talking about that we have an issue with melasma, because even the tiniest bit of sun on that area is going to trigger that melasma and make it much worse. But then you get into the treatment option. You've done everything you can. You're doing as much as you can to prevent it, and you still have it. That's when we get into using other things to lighten it. So typically with these, we typically try and avoid really intense lasers with this one. We always talk about we're avoiding those heat generating or any sort of procedure or process that's going to create inflammation, because melasma on that upper lip loves to pop up in areas of trauma or heat, okay? The other thing is if you overuse things, peeling agents, retinoids, or other things, it actually takes the top layer of skin off, which is good, but if you don't protect it with a sunscreen during the day, you could actually get worse. So there's this really fine balance, okay, between just gentle, okay, enough to kind of slowly get rid of it, okay, but not too aggressive where you're going to make it a little bit worse. Other things that are really common, chemical peels are really common for treatment of this. And then there is other things that we do, definitely skin pen, PRP are another great options for this, but non-heat or non-thermal based type of treatment options. So it's a struggle, and you are not alone, patient who has this mustache melasma, but it's a socially really difficult thing to deal with. So it's definitely something that we're well aware of, and we wish you luck. All right, we have another real common question here next. The next one is, can skin tags be removed? The simple answer is absolutely yes. They can be removed. Do they have to be removed? Absolutely not. And that's if it is a skin tag. Sometimes I'll have patients that come in and they'll say, can you remove this tag? And I'll say, well, it can be removed what you're describing, but it's actually not a tag. You know, I'll talk about, it's a type of a mole, most commonly called an intradermal nevus. Some actually skin cancers can look like skin tags, okay? So first of all, when a patient comes in and asks to have their skin tags removed, we first say, okay, is it a skin tag or not? Okay, so we've got to make sure if it's something that, needs to be sent in, be looked at under the microscope. And then if we decide that it is simply a skin tag, we'll say, well, it can be removed, it doesn't have to be removed. And then we kind of go through based on the size of the skin tag, the removal process. And typically it's a really easy and quick thing to do with very minimal downtime. If you do have it removed, you're probably expecting leaving with just a tiny spot bandage on that, for 1 to 2 days on that area. So really easy question that you gave me, okay? Okay, here's a really interesting question. So the next one is there a way to check a mole or freckle for skin cancer without getting it removed? And that's a really good question. So we see moles and freckles all day long, and some of the different tools that we use in the office is, one thing is we never look at one mole. So if a patient does come in and they do say, can you look at this mole? Does this mole look like it's cancerous? Allow us, we typically recommend looking at all your moles just to see kind of what type of moles that you make. And then if we do have a mole that looks suspicious, you'll see any of our providers in the office pull out dermoscopy. And so that's tools that we have in the office that add different illumination, they add some magnification, it gets rid of that kind of, we call it the epidermal kind of noise, and we can better see pigment patterns. And there's all these different pigment patterns and different signs that we're looking for in the blood vessels and the inflammation and in the pattern of that pigment that tell us if it's a high risk, medium risk, or low risk type of lesion. I mean, I've done 3 to 4 day dermoscopy courses. Basically, all day long, we look at for 3 to 4 days is examples of these pigmented moles or freckles and how to discriminate with the use of dermoscopy, which ones should be biopsies and which ones shouldn't be biopsied. I think that is a great question of there's going to be more and more technology coming down the road, and we're super excited about that. So because anything that we can add to our toolbox of being able to differentiate a good mole from a bad mole, a melanoma from a friendly mole, is going to be so helpful for us, and it's going to save our patients hopefully a lot of heartache in regards to having a lot of moles removed. So I think stay tuned over the next months to years on additional ways, but right now there is a lot of wonderful ways to evaluate moles without actually removing them. All right, we've got our last question here in Ask the Derm, and it is, how long after incorporating retinoids do you wait to decide to stop using that product? I started about a week ago and my skin is freaking out. I was thinking maybe 2 to 3 weeks. So this is a really common scenario that we hear of, and basically it sounds like this person might be new to kind of, we call it the retinoid world, okay? She loves the idea of everything that retinoids can do, okay? Fine lines, wrinkles, anti-aging, and just making that skin look youthful, or possibly treating something like acne or another skin condition. For us or someone else has educated her that definitely your skin's probably going to get a little bit more irritated in the beginning. So one of our sheets that we give patients kind of goes through kind of this, we call it the titration. Like literally week 1, we talk about week 1, plan to apply it like twice a week. Okay, then week 2, plan to apply it like 3 times a week, Monday, Wednesday, Friday. Week 3, maybe you can get up to 4 times a week. The next week, maybe 5 times a week, and it's a slow process. Our goal isn't necessarily for everyone to get up to every day. Okay, that's just not attainable for some people, depending on your skin type. So that's definitely dependent on the type of skin type that you have. So I would say for sure, if it's only been a week, there is no throwing in the towel yet. Okay, at this point, so you are in the early phases. I'm guessing if your skin is freaking out after 1 week, then we're probably overusing it a little bit. So I'm going to have you back down, okay, and basically just get that skin barrier repaired just a tiny bit. Bring your moisturizers, your emollients on, and then add that retinoid back on. Start twice a week, okay? See how it goes. Next week, I want you to try like 3 times a week. Pause. Maybe you're going to stay at 3 times a week for a week or 2, okay, and eventually kind of move up. And then make sure that you're going to take away any harsh cleansers, okay? And be sure that you've got those moisturizers and emollients just to repair that skin. But I promise that most likely that you're going to get there, okay? And you did ask about 2 to 3 weeks. I don't think you're going to be at your goal point at 2 to 3 weeks. It can take my patients 2 to 3 months, okay, to get to a point where they can use that retinoid more regularly. So be very, very patient, okay, and it will pay off, all right? Well, thank you. That was our last question today for our April edition of Ask the Derm. So I hope you guys have gotten a couple little nuggets of knowledge, okay, out of this. And again, anyone who wasn't able to ask their question this month, definitely will be reaching out again next month in May on our social media platforms. So go ahead and submit those questions that you're just dying to ask us, and then see us back in May for Ask the Derm.